Hello and welcome to The Virus. I'm Jeremy Fernandez. Coming up, why some people are getting COVID twice within weeks, and a look at the latest government COVID safety ad campaigns. Are they hitting the mark? But first, let's take a look at the latest COVID numbers. The number of cases that have been detected nationally has been falling in recent weeks. The 7-day average is now around 25,000, and that compares to 42,000 at the beginning of the month. The number of people in hospital has also decreased. Just over 4,000 people are getting care in hospital. 140 patients are in intensive care. As it stands, there are about 78 COVID-related deaths a day. Joe Biden's coronavirus reinfection last month made headlines all over the world and brought attention to what's known as rebound COVID. The US president tested positive just days after he was cleared of having COVID. In a moment, we'll speak to a virologist to find out why that happens in some patients. But someone who can relate to Joe Biden's experience is Mark Staniforth. He joins us now from his second stint of isolation this month. Mark, welcome to The Virus. Firstly, how are you feeling?
I'm feeling much better. I'm really in quite good shape.
Now, this is your second round of COVID, which would be unexpected for most people in such a short space of time. What tipped you off?
Well, I came down with symptoms on a Wednesday and I took a test on the Thursday morning and it was positive. So I called my doctor and I got antivirals prescribed. So I went off and got the antivirals and I started on them that day. Now, the antivirals were truly marvellous and they managed to essentially get me over the virus. So by the time I finished the antiviral course on the Monday, I took a test again on the Tuesday and I was completely negative. I had no trace of the virus left. And I felt really good, and so I came out of isolation on the Thursday morning and I thought, well, that's it, I'm done. And come the Sunday, I started to feel bad again, and so I thought, well, I need to find out what's going on here. So on the Monday morning, I got another test, and sure enough, I was positive again. And what it was the virus had come back on a rebound.
And you feel like you're bouncing back okay this second time around?
Oh, yeah. Once I got over the first couple of days, the second time around, I started to feel quite good again. And I haven't really had any trouble with it. Nothing was as bad as the very first night when I had a very sore throat and a very bad cough. But the couple of days when I got the rebound, I then had a pretty bad cough and felt pretty ordinary. I wouldn't say I was in any great danger, but I wasn't feeling well. But subsequently, I really feel very good the last few days.
Mark, it's good to have you with us. Thank you.
Yeah, thank you, Jeremy.
So how is it that COVID rebounds for some people? Let's bring in Dr. Lara Herrero, a researcher and virologist at Griffith University. Dr. Herrero, welcome to the program. How is it that some people can seem to be clear of COVID and only days later test positive again? What's going on inside the body?
Yeah, look, that's an excellent question, and that's one that scientists and clinicians really around the world are researching quite heavily right now. What we do know is that in order to clear a virus, and that's for anyone, you need a really strong immune system. It's the immune system that is combating the virus. And sometimes the course of that disease and that course of that infection is not entirely linear, if you will. So you get fluctuations. Sometimes the virus titer or the virus concentration in your blood goes up. Sometimes it goes down a little. And you get those fluctuating symptoms as well. So all I can say at this point is we know that the course might not be linear, and some people are more prone to this kind of worsening of symptoms than others.
And so it's a case of the test just being so sensitive, they can only pick up so much.
Yeah, so a classic, rebound, the real rebound effect is where you've been testing positive, you're getting better and better symptoms. All of a sudden you're testing negative, you think you've cleared the virus, your symptoms are resolved, and then 3 days later you take another test and you're positive again and your symptoms start coming back. So that's your classic rebound.
Are some people more susceptible to a rebound than others?
Look, data is still not 100% on this, but it would be the best guess is yes. I think that there would be some people that are more susceptible, and those are going to be the people that perhaps have more comorbidities, more other chronic diseases perhaps, or other lifestyle factors that put them at high risk where their immune system might not be, operating to peak level.
And is a person still infectious in that period when the virus appears to have cleared their system?
Oh, so if you're testing if you have a negative test, and I want to be clear, I'm talking about a negative PCR test, not a negative rat test. They are two different worlds. So if you have a negative PCR test, it's very unlikely that you're infectious, right? So at that point, I would say you're clear, you're fine, you can go out. The negative rat test is a little different. They're not as sensitive at all. And certainly if you have a negative rat test and you have symptoms that are ongoing, I think you should just assume that you're still, infectious.
Let's talk about how reliable rat tests are in these sorts of circumstances.
Yeah, so I would never be putting my money on a rat test. Let's put it this way. If you're rat positive, you're probably positive. Very unlikely it's anything other than COVID. If you're rat negative, it doesn't necessarily mean it's not COVID. If you have symptoms and you're rat negative, I would strongly encourage you to get a PCR test because those tests are highly sensitive.
How strong is the correlation between people experiencing rebound COVID and those who've taken the antiviral treatment called Paxlovid? Because the science isn't strong enough at the moment, as you say, whether there's a causal relationship, but there does seem to be a movement in the numbers depending on what sort of treatment you're getting, right?
Yeah, look, that's right. So as the uptake of Paxlovid is growing worldwide, and certainly the drug itself has got some major advantages. So this is not a commentary on the value of the drug so much as saying that the data we're collecting now that seems to suggest that we are getting, rebound or more and more cases of rebound with the use of Paxlovid. That being said, the rebound effect is still very small, as in it's happening in a minute population, and usually it's coming about with people who have a comorbidity. That being said, Paxlovid is still doing a very good job at protecting people from dying, so there's a lot of advantage to that, obviously. The data is still going to come. Paxlovid itself works on inhibiting the virus's ability to replicate. It does not kill the virus. Your immune system still needs to do its job in killing the virus. So it's still a timing game, and Paxlovid is just slowing that virus down and enough so that your immune system can get on top of it.
And we're also learning about how antivirals can be used in these sorts of contexts. So something as sensitive as someone not taking the drug as prescribed can mess around with the results too, right?
Absolutely. So any window of opportunity that virus has to start replicating back up again, it's going to take that opportunity. And, we don't want to personify the virus. It doesn't have its own little personality, but it will take the opportunity and it will start replicating again if you take that antiviral pressure off it. And once that happens, you put your immune system yet again on a back foot.
Dr. Lara Herrero, great to have you with us. Thank you.
Anytime. Thanks for the chat.
Now, at the beginning of the pandemic, we were bombarded by government advertising campaigns telling us about the latest medical advice. But have you seen the more recent COVID safety ads, like this one?
When leaving home, please wear a mask when indoors or in crowded places. Cover your cough and wash your hands. Remember physical distancing. Test if you have symptoms and stay home if you have COVID-19. Together we can help slow the spread. Visit australia.gov.au.
So just how effective are these newer campaigns at getting the message across? Linda Ashalem is the National Campaigns Director at SEC Newgate and has previously worked as a political strategist for the Labor Party. Linda Ashalem, welcome to the program.
Hi, thanks for having me.
Ads like that are pretty straightforward, no bells and whistles. There's not even anything new really in it to tell us. How useful is that?
Well, we've just got to be very clear that we've come from a really long way since the pandemic started. And so there's a lot of fatigue about COVID, and in the community out there, there's not a high degree of concern about COVID. And so, to the point about whether these campaigns are effective, they just need to be very clear, very informative, have a very simple message, and be able to be conveyed and understood in a very clear and simple way. So in the sense of what is a very a good public health message, they are top notch in terms of being able to kind of tick all the boxes of what they need to be.
So what does make a good public health campaign?
We've done extensive research into this, and the conveying of the messaging needs to be able to kind of clear through the clutter of lots of messages that people are bombarded with daily, and you've got to be kind of cognizant of the sort of multiple channels of information that people are also accessing information, and the sort of sources of information they might have. And so being mindful of that, you've got multiple sources of information in terms of TV, social media, Google searches, news sites, but also information from friends and family and so on. And so what makes an effective campaign is something that is clear and simple, straightforward, factual, and backed with or presented by credible voices and experts in the field in terms of public health messaging. And what it does is it kind of counters the masses of information that's out there and the sources of information where there is a little bit of misinformation and the ability for different messages to kind of get pushed through. So lots of communities have access to sort of WhatsApp groups, or they're sort of receiving information through their social media channels. So the effective thing to do in a public health message sense is to kind of be very clear, simple, have experts lead the advertising, have it credibly presented by people who really understand the impacts of public health, have it easily digestible, have it repeated over and over again and across a range of information sources, so that it cuts through the clutter of messaging, but also the rising prevalence of sort of misinformation and alternate messaging.
You mentioned fatigue earlier on. That must be a really difficult thing to cut through in the circumstances like we are in now.
Absolutely. And I took a look at some of Newgate's research over the past two and a bit years, just to get a sense of just how much COVID as an issue has dropped as a main source of concern for people in their day-to-day lives. And during the pandemic, we were seeing kind of COVID be the number one issue of concern for the majority of people. It was sort of sitting in the ranges of sort of 50, 60, 70%, of people surveyed identifying it as their number one issue. In this year alone, between March and June, COVID as an issue in terms of people identifying as a main concern for them has dropped significantly in this year alone. In March, it was at about 30%, and as recently as June, it's dropped to about 10%. The concerns that have overtaken COVID are things like obviously cost of living, housing, climate, housing affordability, climate change, healthcare and access to affordable healthcare services, and also sort of the cost of petrol prices rising as well. And when you think about the sort of the general economic issues and environment/economic issues that are sort of rising to the top, you could see that there's a lot really to worry about. And if you think about an average, an everyday person living their day-to-day lives, kind of getting up in the morning, getting the kids ready for school, taking their kids to school, and kind of getting themselves to work as soon as possible and coming home. And in the scheme of things, there is just so much to worry about. And so COVID, more and more, you're seeing it drop to sort of the bottom of the range of people's concerns. And so it is very, very hard to acknowledge that there is a complete change in the communications environment, where this has been, the major concern for people for most of the last 2 years, to the concern number 8 or 10 out of the list of things that they really do need to worry about. COVID as an issue is just becoming a little bit like just the last thing you want to hear about day to day.
Linda, Ashalem, great to have you on the program. Thank you.
Thank you so much.
And that is the show for this week. Thanks for your company. Bye for now.